So we have Tom coming in today for a little help with his upper back and shoulders. He's got some tension up in the scapular regions, the rhomboids, as well as the traps, and a little bit in the neck as well. So we're going to kind of go through and needle some points today. Low back too? A little bit? Okay. So we're going to go ahead and kind of feel around for the tight points, the tender points, and we're going to needle into those areas. A lot of the tension that he holds is up in the upper part of the back, which kind of mirrors the lung, the pericardium, the heart. And so we're going to do some of those points for the direct tension, but also to kind of tonify and nurture those points correlative to the organ systems. So we're going to first go ahead and feel the pulses before I put gloves on. A little bit weak in the lung area and in the kidneys as well, so we'll work on tonifying those spots today. Okay, so I'm just going to go ahead and put on a pair of gloves. So I think I'm going to actually start with a couple points along the governing vessel. The governing vessel spans along the spine of the body, and it goes up over the head and it lands at the little space between your nose and your lip. And it starts actually in the perineum. We won't go there, but that's where the channel begins. So we're going to do governing vessel 4, we're going to do governing vessel 14, and then we're also going to do the governing vessel point that is over the lungs, which is on the 3rd thoracic vertebrae. So sort of just to ground the energy of today's session, today's going to be a lot of trigger point needling, but we're going to still ground him with governing vessel 4. So governing vessel 4 is at the 2nd lumbar vertebrae, and the way that we locate the 2nd lumbar vertebrae is by feeling into the lower aspect of the rib cage. And when you kind of guide your finger along that spot, you land at the 2nd lumbar vertebrae. And so right here is due 2 or governing vessel 2. And that's just a brief little needle, and it goes right under the spinous process there. And due 4 is really a great point at nurturing kidney energy. We're also going to do urinary bladder 23, which is 1.5 Tsun lateral to both of those spots. That helps to nurture the kidneys as well. And I'm doing this sort of not only because of what we felt in the pulses, but also just because I know that Tom has some chronic lung issues. And when there's lung issues, we always want to treat the kidney, because the kidney is responsible for grasping what we call the dachi, or the air in our external environment. So kidneys help us inhale and our lungs help us exhale. And so 1.5 Tsun is sort of like, I would say, just over an inch from the spinous process. And I always like to sort of needle by sort of just kind of tapping it in, and then you wait a bit before you insert it any deeper. And so here, just threading it in a bit. Okay, so now that he is sort of grounded, we're going to go to the upper area. And I'm going to start with Do 14, which is governing vessel 14. And that's pretty easy to spot because that point is right at the boniest prominence, the boniest vertebrae at the top or the bottom of our necks. So this point is really easy to find if you just kind of feel around the top here for the boniest protuberance. That's C7, and below C7, the seventh cervical vertebrae is Do 14. This point is excellent for removing heat from the body, and it's good for lung stuff as well. Okay, and then from there we can kind of count down. So the vertebrae just below that is T1, and then T2 below that. So let's see, T1, T2, T3. At the level of T3, we have a few points that I'm going to be doing. One is urinary bladder 13, which is 1.5 Tsun lateral to the third thoracic vertebrae. And so 1.5 Tsun is about 1.5 inches, I would say. And we will needle like so. And then for symmetry's sake, we're going to needle the other side, which is 1.5 Tsun lateral to the third thoracic vertebrae. And then 1.5 Tsun out from bladder 13, which is 3 Tsun out from the lower border of the third thoracic vertebrae, is UB42 or urinary bladder 42. Now this point is a powerful point for emotional issues connected to the lung. So this point I really like to not only needle but use moxibustion for, to sort of nurture the inner child within us that has more deeper seated or childhood issues relative to the lung. So 1.5 Tsun out from urinary bladder 13 is UB42. And we'll go ahead and needle that. And when you're over the lung area, you never want to needle perpendicularly, just because that is a very good way to puncture a lung. So if you see people deep diving in and around the lung area with needles, you can pretty well assume that they're either untrained or they don't somehow know that the lungs are right there and they're probably puncturing their patient's lungs. So we always want to needle very obliquely at a very shallow angle so that we know that we're just hitting muscle tissue. So now the next point I'm going to do is gallbladder 21. Gallbladder 21 is at the prominence of the trapezius muscle here. So I always like to pinch that muscle and then sort of find the tippy top of that muscle. And we're going to go ahead and pop that one in, and then You okay, Tom?
Mm-hmm.
Good. Okay, then we're going to go to the other side and do the same thing. Okay, with gallbladder 21, you also want to be careful not to go too deep perpendicularly there because the tippy top of the lung is sort of right here. So I always like to hold the muscle so that I know that I'm nowhere near the lung. And the needles that I'm using are about 1.5 inches, so they're not too long. And next we are going to go ahead and needle right over the levator, and that's because when we were palpating him earlier we found that some of the tighter muscles were in through this general vicinity here. So this is the levator scapula, and I like to sort of pinch that up as well and tap it in. Okay, I'm going to go this way on this one. Okay. Okay, so next I'm going to feel around in this general vicinity. Yeah, so this is UB42. We're going to go ahead and needle UB43, which is 1 spinous process lower and 3 tsum out again. So this point is really tender there. I can feel it, or well, tense, I should say. So we're going to go ahead and kind of push that muscle group up and needle that. This is another really good point for lung issues, asthma, allergies, and again, it's one of the emotional shoe points. So tender there? Yeah, okay. All right, so then we're going to go ahead and pop that one in. Very good. And then I'm just going to feel around here, not necessarily for points, but for tender spots. And so these are more ashi points that we're looking for. Tender there?
Mm-hmm.
And there?
Not as much.
Not as much? Okay. Yeah. And so this is in and around UB42, but it's a little off the point. So we're going to go ahead and needle that. Very good. Okay, and then tender there?
Mm-hmm.
Yeah, okay. And then to balance things out, I always like to do points that are on the limbs. So we're going to go to his feet first, and then we're going to kind of ground his energy there. Okay, so we're going to do kidney 3 and kidney 6, and also urinary bladder 62. And then we'll do small intestine 3 on the hand when we're done on the feet. And so I like to do urinary bladder 62 and SI3 combined when there is back pain involved, because the urinary bladder 62 and SI3 points are the Dumai vessel extraordinary points. And so by opening this extraordinary vessel, beginning with UB62, it helps to sort of treat all melodies relative to anything presenting on the Dumai channel, which is along the spine. So we're going to go ahead and needle UB62 on either side. UB62 is sort of in between this little tendon that is on the medial or lateral aspect of the ankle bone. And then kidney 3 is on the inner aspect of the Achilles, sort of in line with the protuberance of the medial malleolus. So we'll go ahead and needle that. And we'll needle it on both sides here. Because we have 2 kidneys, I always like to kind of keep it even, unless I'm doing a balance method treatment. Okay. Wonderful. And then we're going to go ahead and needle SI3. All right, so SI3 and I'm also going to do heart 4 actually. So SI3 is sort of right when you make a fist, sort of right here in between the border of the red and white skin here. And so this one is typically a little tender, but it's really good for neck pain, back pain, upper back pain. SI4 is also really good for more lumbar and hip pain as well. So because he had a little bit of tenderness there, we'll do SI4 also. And then heart 4 is right on the pinky side of the inner aspect of the arm. Like 1, 2, 3, 4 little spaces from the wrist crease. And heart 4 is really good for relieving pain in the neck and shoulders. This one can be a little zesty too, but it's a really great point for neck and shoulder pain. Okay, so then I'll go ahead and needle SI3, 4, and heart 7 on this side. Right. All right, someone's hungry. Okay, so the last points I'm going to do are on the glutes, actually. So we're going to go ahead and needle, these lower back points here, which are more like UB32 area, and then gallbladder 30 as well. When we have tension in the lower back, it's a really good thing to sort of release the glutes. So that's where we hold a lot of tension, especially if we are active and doing squats and running and that sort of thing. So we're going to go ahead and needle And that's just the ashi points in this area. Tender in those spots? Yeah, okay. All right. Tender there? Yeah. Okay. And then we'll go ahead and needle gallbladder 30, which is right in this area here, kind of right over the sciatic nerve. Actually, I'm going to use a larger needle for that. This is a 40 millimeter needle. And so right at the center point of the glute here, and we are going to needle this one fairly deeply. Ooh! Did you feel that jump? Yeah. Ooh. Again, good. If you ever have sciatica or any pain that travels down either the side of the leg or the back of the leg, you should see an acupuncturist because we can resolve it in a very short window of time. The sooner you get in, the better. Felt that one? Yeah, okay. So these ones go nice and deep. Ooh. And it oddly feels good, right, Tom? Okay. So we have a good selection of needles going here. We are going to let these cook for a bit, and then we're going to come back, pull, and then do a little scalp acupuncture to finish today's session, okay? Okay, so we are back, and we are just going to go ahead and pull these needles. So I will begin at the top, pulling gallbladder 21, pulling these levator ashi points, pulling do 14, UV 42, UV 13, UV 43, UV 44-ish, UV 23, do 4, UV 32-ish, gallbladder 30, and then we'll take out heart 4, heart 4, SI4, SI4, SI3, SI3. And then we will go ahead and pull UV62 on each side, as well as kidney 3. All right, so next we're going to do a couple scalp points on Tom. And these points relate to the low back and sciatica, and they also treat the lungs. So it's kind of a good catch-all for exactly what he's going through right now. So the first point we're going to do, these are all master tongue points. The first point we're going to do is right around the area of gallbladder 8, which is about 1.5 cun above the apex of the ear. So kind of in through this area. And again, with scalp acupuncture, you sort of want to feel around for the tender spots. And the points are kind of on the tender spots rather than exactly correlative to where their locations are listed in any book. So right here we have 1010.23 or Zhuoho, which is prefecture fire in Chinese. So 1.5 cun superior to the tip of the ear, on the gallbladder channel, close to Shuai Gu, which is gallbladder 8. Is that tender there?
Mm-hmm.
Yeah, okay. So we're gonna swab that point, and then 1 cun posterior to that is 1010.24, and that is Zhoujin, which is also known as prefecture metal. And this is 1 cun or 1 thumb breadth from gallbladder 8 or 1010.23. 1010.24 is right around here. Is that tender, Tom?
Not so much.
Not so much? How about there?
There, yeah.
There, okay. All right, and then 1010.25 is a 2-point group on the Dumai channel, which is the governing vessel, which we talked about earlier. And this is the first point is at the tip of the external occipital protuberance, and then the second point is 0.8 cun above the first. So when you feel around the occiput here, you're feeling for the tip of the external occipital protuberance. And so 1010.25 or prefecture water, the first point of it is right in here. Is that tender?
Mm-hmm.
Yeah. I can almost feel like a lump there. Not the lump, but a lump. And then the second point is 0.8 cun above the first, so right around there. You feel that?
Mm-hmm.
Yep. Okay. Okay. So first we're going to go ahead and do 1010.23 or prefecture fire. And I am going to go ahead and put some gloves on. Okay, so about 1.5 cun. Right there, right?
Mm-hmm.
Okay. So this point I'm going to needle downwards towards the ear. And to do that, we sort of thread that needle in like so. And so then that one is prefecture fire. This one is for low back pain, fatigue, palpitations, rheumatism, and the reaction area is the heart. And then 1 cun posterior to that point. So right around here, right?
Mm-hmm.
Yeah. So this is Zhoujin or prefecture metal, which is 1 cun posterior to this one that we just did on the gallbladder channel. And again, I'm going to go ahead and needle that one pointing downwards. The scalp is so great at treating motor sensory issues. So I mostly use scalp acupuncture for stroke patients, for sequelae of stroke. So if you have family members that have recently had a stroke, go find yourself a good scalp acupuncturist, because there are entire areas of the scalp that correspond to, you know, the areas of the brain that help to sort of wake up the nervous system in that area. And so then next we have 1010.25, which is prefecture water, which is right at the external protuberance of the occipital, or the external occipital protuberance here. So this point was tender. So we're going to kind of needle that one facing upward. And then the point that is also 1025 is 0.8 sun above the first. So 0.8 sun, so not quite one whole finger breadth. And we'll just sort of thread that upwards. And so this one I forgot to mention is for sciatica, low back pain, rheumatism, and the reaction area is the lung. For these 2 points, these are for spinal pain, lower limb paralysis, weakness, numbness of the lower extremities, and the reaction area is the kidney. Okay, so we're going to do one more point, and that is 9905 or Jin Air, which is called metal ear. And this is at the upper 1/3 of the outer edge of the dorsal aspect of the helix. So right sort of in this area here. And this point, I'm going to get a cotton swab. So 9905, which is Jin Air or metal ear, it's at the upper 1/3 of the outer edge of the dorsal aspect of the helix. So I'm actually just going to look around for these little varicose veins here and needle close to that point, but more close to those veins. Let's see. All right, so this point is on the back side of the ear, sort of right in through there. And that is metal ear, and the indications for that are sciatica, allergic rhinitis, scoliosis of the lumbar vertebrae, common cold, and allergies. So it is allergy season. Tom has been suffering a bit, and so this point is a really good one for that one. And actually, so this area is a really good place to do some bloodletting. There's some varicose veins here that I really want to bleed, and so maybe we'll do that another day. But for now, we'll just let these sit for a bit, and then we'll come back later and pull. Okay, so we're going to go ahead and pull these needles. Okay, so that one didn't really produce any blood when I pulled it. So I'm going to just kind of peer around the back of the ear. And if you're at all squeamish, you can feel free to leave, but I'm going to take just a single lancet and bleed some of these varicosities on the back of the ear. Bloodletting is sort of an ancient technique. There are various schools of thought on the effectiveness of it, but all I can go based off of is my clinical experience, which tells me that bloodletting is extremely effective, especially for pain and inflammation. When we have varicose veins, those are really good indicators that there's blood stagnation near those areas. So we are going to stay gloved. And I'm just going to quickly pop this point right here. And see if it lets out any blood. I might need a better lancet, so I'm going to go get that actually. We are going to go ahead and do just a little bit of bloodletting. We'll see if we can avoid waking Tom up. So that one's a good one. And with bloodletting, you kind of go for the varicose veins and you let them sort of bleed however much they want. You maybe push on them a little bit, you just get a few drops out. Some of them bleed quite a lot when you do that. You just follow their lead. Got some varicose veins up here at the apex of the ear as well. And so we're going to go ahead and just poke sort of the meeting point of those. There we go. And we just let it bleed a bit. Bloodletting is so good for just pain and inflammation. I have one patient who comes in for migraine treatments, like specifically bloodletting. I usually don't offer bloodletting to my regular patients unless I've known them for a very long time, because it's one of those like touchy subjects where you don't want to just like say, hey, let's do this medieval torture technique on you and see what happens. But because I've seen it work so beautifully in my clinic, I do offer it to people who I think need it. I have one patient who comes in for migraines, And if migraine hits her, she will drive 45 minutes to see me, or well, she'll get driven here by her partner, and we will go ahead and bleed her ear along with all the Jingwell points on her fingertips, and she leaves here without a migraine every time. So I've seen the power of bloodletting, and I can't deny it. If it didn't work, I wouldn't do it. So, all right. And then they just eventually sort of stop bleeding on their own, but I always just like to check and make sure they stop. And sometimes you'll get a little tiny bruise there for a little while afterwards, but as you can see, Tom is sleeping and it's really not that bad. Okay, and so finally we are going to do a couple of ear studs. We're going to do a point that you've heard me do many times on this channel before. And that point is ear shenmen. And we're going to use one of these single-use Apex semi-permanent needles. And this is the sort of injector. So we're going to go ahead and find the upper outer edge of the triangular fossa here. And 1, 2, 3. And I don't even think it will come up. So then that becomes like a little stud that will stay there for like 5 days, and your body will eventually kind of push it out. So we'll go ahead and end today's session there. I'll gently wake Tom up, and we'll see you guys next time.